Everybody, and Jane, thank you so much for that welcome, and thank you to the All Ireland Institute for inviting me to present this informal webinar today around the journey from research evidence to policy impact. And thank you for the suggested title as well, because that's always useful to have some guidance on what might appeal to members. I am speaking here today from the Faculty of Nursing and Midwifery based at the Royal College of Surgeons in Ireland. We are a growing research faculty, and we are currently undertaking multiple projects really around not just nursing and midwifery, but health services improvement, and a real burgeoning area of interest in palliative care research. And we're active members, several of us are active members of the Palliative Care Research Network, and I think I'm the newest member, although there may be one or two following me. So thank you. Jane, if you wouldn't mind moving the slides on, please. Thank you. So some acknowledgements today, because as I say, I'm speaking on behalf of a team of people and collaborators. And firstly, thank you to colleagues at the All Ireland Institute, Karen Charney, Melanie Nugent, Dr. Mary Rabbit, Dr. Buzra Ertugrul, Martina O'Reilly, sorry Jane, I missed you, Lisa McGurr, Neva Donnelly, and Sally Coventry, who we've worked with previously on the position paper, and I'll come on to talk about that as one of our case studies this morning. And also a huge thanks to the team that I work with in the faculty, led by Professor Mary Lynch, who's on our call today, Executive Vice Dean for Research, the support from Professor Mark White, Executive Dean, and Professor Mary Rose Sweeney, Executive Vice Dean for Education, and then colleagues that I work with on a day-to-day basis, Professor Mary Carney, Dr. Llynnoll Spencer, Dr. Shua Yang, Dr. Selina Flox-Moglen, and Dr. Erica Harno. We are a team that work incredibly well together and support each other through various projects. And then some more personal thanks towards expert advisors that extend back into my early career. And these were actually my PhD supervisors, Professor Fiona Ross, CBE, Professor Tricia Grocott, and subsequently a lot of work that I've done with Professor Tushna Vandravala around health psychology and health inequality. So just wanted to say thank you to all of those. And that's not an exhaustive list, but those are the key players that I wanted to acknowledge today. So please move the slide, Jane. Now, so this webinar today, I'm taking a wheelbarrow approach, and what I mean by that, I'm taking a very practical and functional look at evidence to policy processes. I want to make this feel accessible so that anybody can try. It's not highly technical or theoretical discussion, and also the key message that this journey rarely goes in a straight line from evidence to policy, and actually it's probably not a journey, it's more of a series of events and revelations. So thank you, Jane. Today's journey, I'm going to start by looking at why policy impact, why it matters, and then look at two case studies. The first is from the All Ireland Institute position paper, and I've actually presented on this before, and there is a recording online, so I'll just be touching on this case study from the perspective of policy impact. And then an ongoing case study from the Attune project, which is a major project that I'm currently leading for the Health Research Board. And then I want to provide some lessons that I've learned over my career around the impact of evidence in policy making, and then present a practical framework that's in development currently that we're looking to develop further in 2026 and into the future. Some conclusions, and then move on to the questions and answers. So thank you, Jane. So I'm going to start this journey by taking you back to 2005. This is a significant year for me, but also a significant year in events. Ellen MacArthur had just sailed around the world. King Charles and Queen Camilla were getting married, and government was at that time in a state of change, as we should say. At that time, I was working in an organisation called the National Nursing Research Unit, which was it's a UK unit funded by the National Institute of Health Research through their policy research programme. And at that time, we, in the unit, we were a small unit of about 15, were producing policy recommendations for various governments, so the Brown government and then the coalition government. And the members of parliament were coming to us and civil servants and asking for, we want to know what are the evidence on particular issues, whether it be to do with safe staffing in hospitals or looking at, say, 12-hour shifts, skill mix, workforce productivity and retention, big challenges around immigration at that time, and the ID cards were being rolled out and discussed, and so there was a lot of interest in sustainability in healthcare and the nursing role in protecting patients and quality in health services. There'd been some huge inquiries, lots of scandals, and the governments, no matter which party, recognised that health was a critical issue at that time. So our unit were creating these briefing papers called Policy Plus, and what they were like was that it was a rapid review, and then we would produce these papers. We were tasked with trying to get it down to 2 pages on what are the key issues, and this is what policymakers were asking us for. We want to know what are the key issues, what are the policy implications, and over that time period of about 5 to 7 years, we produced 75 of these policy briefing papers. Now, they have all been archived, and it's incredibly, I was looking back over them, incredibly significant to see how relevant some of these still are, even though theoretically things move on. But it shows you that the pace of policy making isn't always as rapid as we expect, and that issues don't always go away. So that was my introduction, my beginning point to policy relevant research. Jane, if you wouldn't mind moving on. So I'm going to take you forward to 2008 now. So this is 3 years later, and I'd started doing a PhD study. And the thing that I was really interested in was power, and how power, knowledge, and service use of voices do or don't overlap. And I'd spent 3 or 4 years on a doctoral study and looking at developing models really around reflexivity and how we can reflect on how policy, social context, theory, methods, interactions with others, and your own personal perspectives and ways of thinking and biases really influence the decision-making process and your understanding of a particular topic or process. So at the end of that, I produced a publication, a paper. You can see then my name was Smith at that point. That was before I was married. That's I checked in this week. That's had 27,000 views and over 200 citations. And it really shows you that people are striving to understand who wins and who misses out in these decision-making processes, and how can we make these processes more open and more transparent so that we can say that decisions have been evidence-based and that policy is reliable and robust. So that was a key question for me: who wins and who misses out when we're talking about policy and different levels of policy making. Thanks, Jane. If we move on. And it wasn't just me that was asking these questions by any means. Catherine Oliver was a key influence and key player. And this seminal paper that was produced in 2014, a systematic review of barriers to and facilitators of the use of evidence by policymakers. And it was really reiterating those things, that it depends on this analysis was of 145 studies, that there were three things coming out of it: that for policy to be for evidence to be taken up in policy, it required that evidence to be timely, but also to be quality, and that's about trust. People want to know that that the results are trustworthy, but it took more than that. It takes collaborations with policymakers, again, about trust, who they go to, who they ask for. And we can think, when we think about COVID and who were the scientists that were advising government, that was about trust, and where we actually placed our trust in the science. And it was a strong message that came through at a critical time in our history. And this third area around relationships and skills building for policy impact. Now, I've highlighted that in red because that was a key question for me at that time. I was coming out of doing my doctoral studies, and I wanted to know, how do I go about building relationships? How do I go about building skills? And how do I go about building policy impact? Can we move on, please, Jane? Thank you. And then going forwards to 2021, another seminal paper emerged around evidence-based policy making and how implementation science, which is a whole area in itself, there's a whole entire journal devoted to implementation science and integrated data systems, again, a whole area. This was the first paper really to bring those aspects together and question, how can we make more effective policies with less unintended consequences, less negative consequences for some people? And how can we rebuild transparency and public trust in politics? Again, about power and about trust. But there was also emerging from this paper was about a better understanding of policy impact and influence. Researchers were beginning to, this is largely coming through the UK research excellence framework. They were beginning to question, well, how do we show the impact that we're having on policy? And we want to show that the research that we're producing, the evidence that we're producing, is having an impact. So please move on, Jane. And with that question in mind about actually what is policy impact, I was asked to do a piece of research. At that time, it was called the Leadership Foundation for Higher Education. It's now known as Advanced HE. They wanted to know how can we support research leaders, and by that they meant people working in strategic research roles, to enhance their impact. And they asked me to produce this toolkit, and it's still available online. There's a link there. And there's a web-based version, an app that I think you may have to subscribe to Advanced HE for that, but you can download a PDF version of this. It's freely, openly accessible to anybody. And in that, it is research-based, this toolkit. It was based on an analysis of the REF impact case studies. Nearly 3,000 case studies informed this toolkit. And it was also looking at how to build feedback loops, whether they be verbal or digital, to show impact. And something that's really taken off certainly in the UK context is the idea of testimonials and tracking impact of research, and also the increasing use of theory of change and logic models. So further information about those practical tools are available in that Research Leaders Impact Toolkit. So have a look at that if you're interested. Jane, thank you. So by 2022, and 20 projects later from doing my doctoral studies, 3 children later from doing my doctoral studies and getting married. This is really where my own lived experience kicked in, because by child number 3, by the time I was having baby number 3, I was classified as a geriatric mother, and I was subject to really high risk assessments. Was offered cesarean section. The baby had to stay in hospital for a week. There was absolutely nothing wrong with me or my daughter, but it was simply because the algorithm had highlighted that we should be high risk. We are high risk, and that potentially something was going to go wrong. And that led me to think that's not just algorithms that are being used in healthcare practice. That's down to algorithms that are going to be filtering their way into artificial intelligence, and how these biases and unhelpful risk assessments might end up controlling the access that we have to services and our experiences of services. So I had a growing interest in AI and a growing interest in engaged research. How can we engage through patient and public involvement to ensure that the voice of reason is heard, not only in our policymakers and policymaking processes, but when we hand these processes over to AI to make those decisions for us. And that's around that time I was involved in something called the National Institute for Health Research Shared Commitment to Public Involvement in Health and Social Care Research. And this is a really fantastic umbrella voluntary commitment that I think they have 32 membership organisations now, not just UK based, all over the world, around that shared commitment to public involvement in research. So if you're interested in PPI, definitely worth having a look at that organisation. And then I also became involved in the National Coordinating Centre for Public Engagement, and I'm pleased to say that about 2 weeks ago, a piece of work that I did for them several years ago has now been approved for publication, and that's a review of 10 years of public engagement, and you can find that on the National Coordinating Centre's website. So thank you, Jane. Part 2, looking at the case studies. And as I say, I've presented on the All Ireland Institute's rehabilitative palliative care position paper previously. So I'm just going to give you a brief view of how we did it in that project. How do we do this evidence to policy? Thank you, Jane. So the palliative care policy context at the time that the project started in 2024, Ireland's National Adult Palliative Care Policy come out, Northern Ireland strategy was being debated, and people could see that there were shared common goals here across the island of Ireland for person-centred palliative care, an emphasis on quality of life, symptom management and holistic support. Involvement in patients and families was gaining ground. And then real focus on service integration and continuity of care. And then a key issue that's really influenced my subsequent research was around expanding home-based care and hospice services, and particularly the voluntary sector in that. Thank you, Jane. And I just want to show you this diagram, which emphasises that policy operates at multiple levels. We have, when we think about a high-level European Commission policy, we have national level policy, regional or state level policy, and local and organisational policy. And I was thinking about this morning. You can even have policy in your own home. We might call it boundaries or the way we do things. So policy operates at multiple levels. And who's in control, who's making those decisions, changes all the time. But the key point for me is that people with life-limiting illness and their families and the people who care for them must have a voice in policy at all of those levels if provision of care is to suit them, is to be person-centred, is to be flexible and responsive to their needs. Thank you, Jane. So looking at the project around the rehabilitative palliative care position paper, we began the project by looking at what the rationale is for rehabilitative palliative care, and essentially it provides the type of care and outcomes that people want. Reduces deconditioning and unplanned admissions to emergency departments, and it improves healthcare effectiveness and the use of resources, and it supports the family engagement and person-centered care, the inclusion of people, and also the inclusion of groups who might not normally be on the receiving end of rehabilitative services, such as people with non-malignant disease and younger adults. Okay, thanks, Jane. How we did it. So this is quite a time-sensitive, rapid approach to developing the policy paper. It involved a robust scoping review of the literature. It involved a seminar, a whole-day seminar, and people on this call may well have been part of that seminar. And within that seminar, an hour-long stakeholder engagement, a really interactive session where nearly 80 or more participants gave us real valuable insights into rehabilitative palliative care and future directions. And then post-seminar, we held 6 online groups to discuss what had come out of the seminar and the workshop, and to really develop and refine that with the steering group committee members who are included in the acknowledgements. And by September 2025, thanks, Jane. If you move on the slide. So that's an image from the workshop and all of those post-it notes showing what rehabilitative palliative care comprises and who are the key players, who needs to be involved in future development, and what needs to be done to implement and evaluate rehabilitative palliative care. Thanks, Jane. So by the end of the process, we had a huge report, 216-page report, and that's available on the RCSI repository if anybody wants to have a look at it and the full details of all of that data that was collected. And then through discussions with the steering group, we identified what are the key policy recommendations here. And we produced a green paper in November 2025, the first position paper on rehabilitative palliative care. And again, that's available online, and open to feedback and consultation on that, open to hear perspectives on that, and how that is taken forward. If you move on now, please, Jane. Thank you. So the second case study that I want to talk about really builds on that stakeholder engagement approach that we'd seen and developed in the All Ireland Position Paper project. And this project, the Attune project, officially launched in December, but we had our kick-off meeting at the Royal College of Surgeons in February this year. Again, a highly collaborative project, and it was funded. It is funded by the Health Research Board through their Evidence for Policy programme. So there's an explicit element of this project that requires an integrated knowledge transfer plan to be developed and submitted. So we did that back in January. That was agreed with all our members, Department of Health, Health Service Executive, and our voluntary and community sector partners, and our academic partners, and ESRI, who also are partners on the project. Move on, please, Jane. So there you can see more of our partners on this work, and we meet monthly, and we have various approaches to that integrated knowledge transfer. Jane, if you wouldn't mind moving on. The purpose of the project really, I mean, this was defined before the project tender came out was to inform the new statutory home support scheme to enable people to live in their own homes. A focus on equity, a focus on human rights approaches, high quality services and regulated home care, connecting with the Sanctuary Care rhetoric of right care, right place, right time. Thank you, Jane. And this was the specific focus of what the Attune project aims to do, listening to those service user expectations and experiences, moving forward with greater insight, how best to direct home support resources so that people can be supported through infrastructure services and career care pathways that are really more responsive to their needs. Thanks, Jane. This is a highly simplified version of the study design, really 3 major components to it: a national survey of older adults. I currently have nearly 300 surveys sitting on my kitchen table to process. We have interviews with older adult service users ongoing. There will be an electronic version of the survey going out, but I want to make sure that the paper-based version, people are answering that in the ways that we hope they would, and that the data that we're capturing all of the data before we release the electronic version of that survey. So that may well come out through your networks, you might see it. And then the third element of the project are these ongoing discussion groups that really conveying emerging lived experiences to policymakers. Next slide, please, Jane. This is an example of how we're doing that. So in our meetings with policymakers, we'll present them with direct quotes and really break it down into themes for them and communicate with them what we're hearing, some nice catchphrases, nice concepts, and explain it to them in such a way that they can make use of it in policy. It's all very well hearing stories and hearing it, but what we're trying to do is bridge that lived experience to what's policy relevant, what can change in policy. Thanks, Jane. And what we're finding, what works, what's working in the Attune project? Well, obviously the stakeholder engagement is essential, and that patient and public involvement is essential. We have a service user care and advocacy panel. They're helping us to design the tools, to practice piloting tools, and we run our briefing papers past them, and they have their own newsletter. So every time we have a big meeting with the SCAT panel, then we'll produce a summary of that. And rather than it being minutes, it's presented as a newsletter upon their request. That's what they wanted. Discussions and having open discussions with our international partners has been critical as well. And you can see there on the far right an image of a briefing paper that was produced from a meeting in May around international perspectives on home support. And I think a key thing of what also works is having our own dedicated website and making use of lots of visuals and presentations so that to bring the challenges and the issues to life in really accessible ways. Thanks, Jane. Here's an example of how a visual around responsiveness can really help to engage people, and they can begin to look at some of the complexity and some of the uncertainties and the gaps in knowledge. Thanks, Jane. So lessons learned for me personally from going from that growth zone towards, I'm saying mastering, but having a clearer understanding of what policymakers want and how to deliver it. Personally, for me, getting through that discomfort, as a trained researcher, you're not necessarily going to be moving in the same circles as policymakers or talking the same language or even thinking the same way. And my way through that discomfort has been to prepare. So every meeting that I go to, I'm prepared, I understand what's necessary, what's important to convey, and I think that really helps to move through that discomfort and cross that boundary between research and policy. And also this sort of sense of a key role in transferring knowledge, and a duty to transfer that, to amplify the lived experiences and voices, and working with organisations like Voices for Care and the All Island Institute and Alone and Volunteer Island, Age Friendly Island, working with organisations like that, we can help to amplify those voices and really cut through and clarify to policymakers what's important right now. I think having confidence in your research methods and the rigour of your research is critical, but also mobilising intellectual capital. And what I mean by that is not trying to do it all alone, involving co-applicants, collaborators, stakeholders, anybody that's slightly more experienced or knowledgeable or can bring a different perspective to the research. Critical to do that. And something that I more and more build into projects is this a structured process for actively seeking feedback and acting on it. Now, we might call that reflection or reflexivity, but building it into projects so that after every meeting, there's an MS forms that goes out to capture anything that wasn't said, because some of the participants and members in discussions are not going to speak during a meeting. There's too many dynamics, too many complexities going on, but they may well share anonymous feedback afterwards. And that anonymous feedback can be more important than what was verbalized during the meeting. So really valuing that process of seeking feedback, and informally as well, asking people, is this approach working for you? Is this meeting time working for you? And making sure that stakeholders can be engaged and they're benefiting from the project. Thanks, Jane. So just to kind of come to the part 4, the conclusion sort of part of this presentation, I want to introduce you to a policy analysis framework to really make this a practical webinar. And this, as I say, it's in development, and it's something that's really emerged from our supervision of doctoral students and early career researchers who are turning to more experienced staff members and saying, how do we do this? How do we do policy now? How do we do policy impact? So we wanted to produce some practical tools to analyse policy and to help them to identify the gaps and where research can influence and inform change. So if you move on, Jane, thank you. So just to say, if you are looking to understand more, a recommended text that always suggest to early career researchers is by Mark Reed. And Mark is a key player in this field of research impact and influencing policy. So recommended reading there. Next slide, please, Jane. This is the framework in development. It's breaks policy analysis down into various categories so that people can work through this or take a category and really think about, what is the scope? What am I trying to do with my research or my project? And then breaks it down into accessible questions, where things that you kind of overlook, like what countries are you working in? People tend to forget that you might be talking about a national policy or regional policy or a global World Health Organization policy. So just to remember, to frame what you're looking at in terms of those territories and jurisdictions, and also looking at the context of policy making and a policy approach, because that can really vary between countries, between governments. It can really change. And thinking about the implementation of policy as well. How is it being implemented? Is it stuck going through an endless policy process, or is it actually being implemented in practice at that time? Any evidence of effectiveness of policies? Now, this is where often find your gaps, because not all policies are evaluated from the perspective of, say, equity and inclusion, or going back to that issue of who's benefiting, who's missing out here. And then key issues around inclusion in policy making and transferability. What elements could be adapted to other countries? What aspects depend heavily on local context? And when we were working on the position paper for the All Ireland Institute, we realised that we could learn a lot internationally, but it had to be implementable in the Irish context. So the other areas were around comparison and insights, and using this framework, those key questions there. What's a valuable comparison to make? How do we choose which comparator countries, comparator settings to make? And then gaps and recommendations around this framework. It supports a more structured and comprehensive analysis of policies. People often struggle to get into policy analysis, to know where to begin, and it just provides that nice sort of access into the whole area of evidence for policy. If you move on, please, Jane. And then you won't be able to see the detail in this at all, but what I've done is showed how that policy analysis framework can be applied to our example from previously, the rehabilitative palliative care, and you can see those various components, and take a look at that if you're interested in palliative care and rehabilitative palliative care, because I think there's some really fantastic comparisons that we could do between Ireland, UK and Australia, as well as other countries. So that was just me playing really with the data and playing with the framework to provide an example that this audience might like. Jane, please move on. So in conclusion, this has been a journey of evidence to policy, but it's also been reflected by a personal journey, a journey of learning and professional growth. And I suppose the key message is that it's not a linear or smooth process, but it's an ongoing cycle of generating knowledge, implementing change, and evaluating outcomes and refining practice. So I suppose, to put that in more simple terms, it's creating understanding that can have an impact on policy for the benefit of those individuals that the policy seeks to serve. And in that cycle, voice and power and knowledge are critical levers, and having that transparency, using frameworks like the one that I just showed you, can really help to open up this whole area of policy making and evidence-based policy making. So I will just finish by, Jane, if you wouldn't mind moving on, with a thank you. Thank you again for inviting me to speak today, and a big thank you to my co-author and Professor Mary Lynch. Has been none of this would have happened without Professor Mary Lynch and her support for this work, her support in me as a principal investigator around the rehabilitative palliative care paper, and building on that subsequently with the Attune project. So a big thank you, big personal thank you to Professor Mary Lynch. And there's some references there if anybody would like to follow those up, all open access, all available through the research repository. Thank you, everyone.